pleased to be joined now by Michael Brauer from the University of British Columbia. Now, we just heard you speak about interventions. What are the biggest challenges with them?
Well, I think, first of all, we need to do evaluations when we put programs in place. So when we put in interventions, we do that with the best intentions. Sometimes we find out that things that we thought were going to work might not work. Things that we thought might not work really do provide benefits. So we need to really do the evaluations, which means measuring, and often the excuse you hear is that I barely got enough money to do the program. How am I going to actually assess it? And my counter to that is what's the cost of actually putting something into place and then finding out afterwards that it didn't provide the benefit. So that's a real challenge. The other thing is the complexity that we're faced with. So we often think about interventions as one thing. People don't sort of live in a single environment where it's only one factor that they're faced with. It's multiple things, and actually that really makes things complicated.
You also mentioned that with interventions, the most successful ones seem to be long, costly, and slow. Why is this?
Well, it's sort of the no free lunch, right? The things that we can do quickly, give us a little bit of return. That's just the nature of it, especially when you're talking about changing behaviors, changing physical environments to really do it right. It isn't an overnight thing, and again, that doesn't really align very well with politics, where we want quick change. But again, I would argue just because it's long and drawn out doesn't mean it's not going to be cost effective in the end, and we've seen that, for example, with things like tobacco reduction. Imagine what the healthcare system would be like if we still had 40% of the population, 50% of the population smoking, compounding against all the other challenges that we face today.
You mentioned cycling, healthy urban design. What are some other programs that might help?
Well, I think one of the things so my work mostly actually has to do with air pollution, and it's something that most people's minds think about sort of air pollution as that factory out there in the middle of nowhere, and it's easy to point the finger at that. Actually, most industrial pollution in developed countries is actually either outside of urban areas, so it really doesn't affect populations, or is cleaned up a lot. The air pollution actually that is most troublesome from a public health perspective is what we're doing ourselves in our cities, which is traffic. And simple things like separating, and it sounds simple, like separating our roads from people, thinking about designing cities for people instead of cars is something that we need to be working on and doing it. And the good thing is that we have examples all around the world, in the US, in Canada, where we've seen success with that. And I would also argue that those examples are actually provide benefits from an economic sense. They're not costly once they're put in place.
And what are your hopes from here? What would you like to see?
Well, I'd like to see cities where people have equal opportunities to move around in a way that doesn't rely on cars. Where if people want to use a bike, to walk, they can get to the things that they need, whether it's a place that they work, whether it's a park, whether it's to buy food or entertainment. They can do that in a way that doesn't require the automobile, and I think that will solve actually a lot of our problems.
Well, thank you for taking the time to stop by and share your insights.
It's been a pleasure.